over recent years, I would say that the psychiatric profession have become a little bit more cautious about the use of antipsychotics than they were, but they don't have a very good track record about being honest and open about the adverse effects. So tardive dyskinesia, which is this neurological complication of antipsychotics, was recorded back in the 1960s, but many psychiatrists spent time over the 1970s and 80s arguing that actually it wasn't to do with the drugs, it was to do with the underlying condition of schizophrenia, and they wrote lots and lots of papers highlighting the abnormal movements that people with schizophrenia have and saying this could be what tardive dyskinesia is, whereas actually it had been shown numerous times that there is this syndrome that's really quite distinct of abnormal movements that's related to antipsychotic use. Not only that, there is a lot of research showing that once you get these abnormal movements in tardive dyskinesia, they are associated with general cognitive impairment, with a decline in people's intellectual abilities. That's been shown in quite a lot of studies, but it's never highlighted as a part of the descriptions of tardive dyskinesia that get into textbooks. And again, I think psychiatrists should have been more aware of this and should have been more open about the fact that antipsychotics can cause this effect and exactly what this syndrome of tardive dyskinesia consists of. It's what's published in the journals really and what's talked about. So if you look at the literature on tardive dyskinesia, there are studies showing this association with cognitive impairment, but they never get followed up. It doesn't get into the textbooks. It doesn't get discussed in subsequent papers. And then there are all these papers trying to link tardive dyskinesia to schizophrenia as well. So it's, I suppose it's just the sort of academic milieu of psychiatry has, I think, not really, for a long time it didn't really want to acknowledge that tardive dyskinesia existed, and it was a few psychiatrists that that had to push the evidence and really make a point that this sometimes irreversible neurological syndrome had been linked to the drugs. So some psychiatrists did take this seriously and did really push the evidence forward, but many others, I think, just found it difficult to face the fact that these miracle drugs, that's how they had been taught about antipsychotics, that these miracle drugs had these, really serious consequences. The long-term use of antipsychotics is justified by numerous studies that have taken people who are on long-term treatment and transferred some of them to a placebo. And if you follow up people in those studies over a few months, the people who are transferred to placebo are more likely, considerably more likely, to have a relapse of their psychosis or to have something that's considered to be a relapse. Now, the problem is that we know that when people stop medication, especially medication they've been on for a long time, that it takes a while for the body to adjust. There's usually some sort of withdrawal effect, some withdrawal symptoms, and so people could in fact be experiencing withdrawal symptoms that are mistaken for relapse. And very often relapse is defined very subjectively. It's defined as a change in behaviour or a sort of minor increase in symptoms. So it's likely that some of the relapses in those studies are due to the withdrawal symptoms of antipsychotics. There's also evidence that sometimes when people are undergoing antipsychotic withdrawal, they may have a relapse of their psychosis or an increase in their psychosis that has been precipitated by the withdrawal rather than the natural history of the condition. So, for example, when people have been on long-term lithium, people with bipolar disorder or what we used to call manic depression, there's good evidence that people's risk of having a relapse after they stop taking lithium is higher than it was before they started taking lithium. So there's something about the process of discontinuing a sedative drug, a drug that restricts and suppresses the nervous system that you've been on for a long time, that is a risk factor for having, usually in people with manic depression, a manic episode. So there is likely to be something similar going on with antipsychotics, that if you've been on these neurologically suppressant drugs for a long time and you suddenly stop them, that increases your risk of having an episode of psychosis. So the practice of long-term treatment for people who have psychosis or schizophrenia is based on these discontinuation studies, most of which stop the medication abruptly, follow people up for short periods, and just look at relapse, often in very subjective ways. There are 1 or 2 studies that have tried to take people off the medication slowly and follow people up for a longer period. There's just 1 study that's published that's done a really long-term follow-up of people who were discontinued from their antipsychotics in a gradual manner. And that study initially showed, like other studies, that there was a higher rate of relapse, usually mild relapses, in people who were randomized to have their antipsychotics reduced. But the 7-year follow-up results show that over the 7 years, the relapses equalise between the 2 groups. But more importantly, that after 7 years, the social functioning of people who'd been randomised to have the antipsychotic reduction was better, considerably better than the social functioning of people who were randomised to just carry on with their antipsychotics regardless. Now, there are problems with that study. It was quite a small study. People didn't stick to the randomised treatment rigidly, so some people who were randomised to maintenance came off their medication, some people who were randomised to discontinuation didn't ever stop their medication, or stopped and then went back onto their medication. But nevertheless, it's a really important study because it's the only study that's randomised people, that's reduced medication gradually, and that's followed people up over a long period of time. And it seems to suggest that having a go at reducing and stopping people's medication is beneficial. It's beneficial in terms of functioning, and it doesn't, in the long run, increase people's risk of having a relapse. So I'm currently leading a project called the RADAR study, which stands for Research into Antipsychotic Discontinuation and Reduction. And we're trying to replicate that small study in a larger sample of people. And we're looking at we're randomising people either to maintenance treatment to stay on their current antipsychotic treatment, or to have a gradual reduction of antipsychotics. And we're looking at their outcome in terms of relapse rates, but also social functioning, quality of life, side effects, symptoms. And so hopefully that study will give us a lot more information about the pros and cons of trying to come off medication sensibly and gradually, even if you've been on it for a long time. Studies of antipsychotics given to volunteers suggest that they slow people down, but also that they reduce people's motivation and drive and create this sort of state of emotional indifference or emotional dampening, as well as making people sort of feel drowsy and a bit groggy. And this is what patients say as well, and they say it over and over again, that they feel slowed up, they feel that they can't think clearly, they feel that their personality has changed, they feel that they're not as interested or creative as they used to be, that they've lost some of their interest in life. And that's a very consistent view from patients. Now people who are really, really troubled by intrusive psychotic symptoms and thoughts, that might be a price worth paying. But for other people it won't be, and it is quite a high price to have your personality changed, your drive dampened in that way. So there was this myth around for a long time that antipsychotics had emptied the asylums, that we were able to shut the long-term mental hospitals because antipsychotics were curing people, and that people were basically just being given antipsychotics and returning to live completely normal lives. In fact, we know that the asylums shut down for political reasons. Institutional care was too expensive and no longer politically acceptable. Antipsychotics enabled that political decision to happen. They enabled politicians to be able to say to the public, look, we've got these wonderful new treatments now, we don't need these big old hospitals. So antipsychotics played a role, but not the role that they're said to have had. So psychiatrists have been promoting this idea for a long time that antipsychotics shut down the mental hospitals. I think antipsychotics can have a beneficial effect in people who are acutely psychotic, and psychiatrists see that. What they maybe forget is that people with acute psychosis, most people with acute psychosis, will recover on their own. And so what the antipsychotics are probably doing in many cases is dampening down the symptoms until they fade away in their own time. But often that's interpreted as the antipsychotics having cured the psychosis.